Do you think this is being overhyped?
Well, this is definitely being over-promoted as a large and dangerous outbreak. It's an outbreak of measles. If you have millions of cases of measles, there'll be complications and fatalities. Right now, we don't have that many cases of measles, and we should speak a little more quietly. Right now, we're actually panicking people.
In terms of your practice, what would you estimate is the percentage of your patients that are not vaccinated for measles?
Up until recently, and even now, it's the majority of patients are not vaccinated for measles, mumps, or rubella.
And you sent out a letter to your patients saying that despite this measles outbreak, there is no risk to their healthy child. How can that be true?
What I said is that this measles outbreak does not pose a great risk to a healthy child. And quite frankly, I don't think it poses any risk to a healthy child.
Do you think the value of vaccines, though, has been overstated?
I think the value of vaccines has been overstated. I think that there are some diseases that have decreased in volume because of good hygiene and good health. I mean, you can still go to countries where there's lesser health and lesser hygiene and see large outbreaks of illnesses. I think that measles could return to the United States if we stop vaccinating. I'm not advocating that people stop giving the MMR. I am advocating that parents have the right to choose how and when they get that vaccine.
Just to clear this up, I believe instead of giving the first MMR at 1, you believe it should be 3 or later. Is that correct?
Yes.
Do you have any medical proof that giving an MMR to a 12-month-old child is unsafe?
I have no evidence-based medicine. There's no research saying that. I have anecdotal data that has told me that. Anecdotal data does not stand up to public scrutiny. It's easy to attack. But I have had, as I said, many parents tell me that they feel their child was harmed by the MMR. I believe them.
In Santa Monica, Malibu, are you worried that in areas like this, there are clusters of people who are not vaccinated, so when the measles does have an outbreak, it's worse in an area like this?
There could be clusters amongst unvaccinated people in Santa Monica and elsewhere. I'm not very worried about it. I opened my office in July of 1984. We have not had one case of measles in this office.
Do you think most doctors give their patients the whole story when it comes to vaccines?
No, most doctors don't give their patients the whole story. Most doctors have an agenda, as do I. I think that I am somewhat more balanced in my presentation, but I think that most doctors believe very strongly in their hearts that the best thing to do is to get all the vaccines in as soon as possible. But I can also tell you that most pediatricians are in large measure vaccine flexible. They do not adhere to these 6 at a time schedule for every single patient. They just don't, because they know that that may not be in the best interest of every child.
So this isn't as serious of a disease as people are making out to be in your view?
It is definitely not as serious a disease as people are making it out to be. It's nothing to be taken lightly, but to frighten people into getting an MMR by leading them to believe that measles has a high complication rate or a high fatality rate is wrong. The last fatal case of measles in the United States was 11 or 12 years ago. The complication rate is very low in healthy children. It isn't a disease to be taken lightly, but it's not a dangerous disease to healthy kids.